A lot of questions remain, and we're going to get to some of them now. Pfizer's coronavirus vaccine could be approved for use in the U.S. by the end of this week. And so we want to bring in Admiral Giroir, who is Assistant Secretary for Health and Human Services, and he's helping determine how the vaccine will be distributed. Dr. Giroir, good morning to you. A lot of Americans are counting on this timeline of late spring, early summer for most of us to be vaccinated. But we've had two setbacks recently, one being Pfizer itself cutting its manufacturing goals from 100 million to 50 million by year's end, and then the second one being this report that we apparently did not secure enough of the vaccine when we had the opportunity. Do either of those reports change this timeline of late spring, early summer?
So thank you so much for asking the question. It's good to be on. No, none of this changes the timeline for late spring and early summer. We will be able to vaccinate about 20 million people this month, and another 20 to 25 million in January, and another 20 to 25 million in February. And again, there is strong commitments that we will be able to provide vaccine for any American who wants it, by late spring, midsummer. That's still our commitment. And the numbers I gave you for December, January, and February is only assuming authorization of the Moderna and Pfizer vaccines. It does not assume any other vaccines being authorized, and we certainly are hopeful that that will happen.
Does part of the plan for that late spring, early summer, somewhat return to normalcy, people get vaccinated, does that depend on more authorizations beyond the potential for Pfizer and Moderna?
It does not depend on it. Again, Moderna has a very large capability to increase manufacturing. And as you know, we have an option for another 500 million doses from Pfizer. But we really are very hopeful that some of the other vaccines will be available. Remember, some of them have different cold temperature requirements. It's certainly possible that the Johnson & Johnson Janssen vaccine, that's a one-shot regimen, so you don't have to wait that 3 to 4 week period in between. But we are very confident that what we have, assuming it gets authorized, remember, we're not cutting any corners here, no corners on safety or efficacy. Assuming we have authorizations, we will have enough to vaccinate any American who wants it, by the May or June timeframe.
You mentioned that you have the option to get more vaccines from Pfizer, but the reporting is that Pfizer cannot guarantee those vaccines until June because they've given deals to other countries. On that subject, the president today is going to sign an executive order prioritizing Americans. From where you're sitting, what effect will that order have?
So from where I'm sitting, I think it's fair to say that the vaccines purchased by America, we need to use those on the very highly vulnerable individuals that we have in our system. You saw the reporting. You've reported some of it even earlier in the intro. Our hospital systems are strained. Our death rates are going up. And we certainly want the vaccines procured by America. That doesn't mean procured by other countries. There are procurements by other countries like the UK and around the world, but those procured by America should be used for Americans who are vulnerable to save their lives.
Yes. I think many Americans would agree. So on that point, does the executive order change anything? And have you heard any discussion of, say, the Defense Authorization Act prioritizing the Pfizer supply chain here in the U.S., so forcing them to sell to us?
No, I'm not aware of any discussions of that. I'm not on the warp speed side, but I'm not aware of any discussions. We use the DPA all the time on the testing side and for supplies, but I've not heard any discussions about that.
All right, some straight talk. Admiral Giroir, thank you very much.
Thank you.
Thank you.